So I would just note that I also have the opportunity to meet with health leaders in other countries fairly frequently and hear the same questions. I would also note, though, that none of them have quite figured it out either. They've all got the universal coverage thing down for the most part, but they don't have cost containment and sustainability down, and they don't have the quality issues nailed. So we're all learning by doing. So Liz mentioned well-funded and fervent opposition. I don't know if Joe Antos comes under the heading of well-funded, but he's certainly fervent. So many of you have seen Joe speak here. He's the Wilson H. Taylor Scholar in Healthcare and Retirement Policy at the American Enterprise Institute in Washington, D.C. He's an economist by training, and over his government career served at a full alphabet soup of agencies, including CBO, OMB, HICFA, and CEA. There's probably some more in there that I forgot. Department of Labor, I know you were there too for a while. So without further ado, Joe Antos.
Okay, thank you very much, Murray, and thank you, Margaret and Paul, for having me back again. I wouldn't say I'm fervently opposed. I'm fervently concerned, and everybody in this room also ought to be fervently concerned about what's going on. You know, I like a non-provocative title, but the issue is, what are we actually doing, as opposed to what was written down, what was imagined 4 years ago, and you know, how's it going? So that's what I'm going to try to address. I've asked Murray to stand up. As you may have noticed, those of you who have been here before, I have a tendency to not notice pieces of paper. So Murray's going to stand up at the 10-minute mark, and at the 5-minute mark, and at the execution mark. Okay. All right. These are the wrong slides. Thanks a lot. Okay. You will not be seeing any of my jokes, unfortunately. All right. Well, okay. So, okay. You're missing about 6 slides that were, I thought some of them were pretty amusing. And they're visual, so I can't really tell them. No, I can't. Okay, so this is going to be a really boring talk. I'm sorry. Okay, but you know, one of the great things about the ACA is that there are so many things that people imagine, and there are so many things, and I'm talking about the administration now and CMS, and there's so many things that you can talk about, and there's so many things that people don't understand, and I'm talking about the administration and CMS. And so I'm going to try to hit a few of those things, but you know, by the time I get to the end of my time, there will be still plenty of other issues to hit upon. Okay, so enrollment, what do we know about enrollment? Enrollment is, of course, behind schedule. Now, it's not too surprising. The website problems were obviously the big issue there. I'm surprised. I wrote an article in early September predicting, you know, slight hiccups. And so I was just as surprised as everybody else, except certain programmers in Hungary, about how that was going to go. But so it's about a million behind the schedule that the secretary or put out privately, but it's out there. There was supposed to be about 4.4 million people enrolled through the exchanges by the end of January, and instead there are 3.3 million people. Now, enrolled, what does enrolled mean? Well, it still does not mean what everybody else thinks enrolling in anything means. It still means that they were able to select a plan, but there's still back-end computer problems. There are still major difficulties, you know, getting from point A to point Z. And so, although, you know, when the administration says enrollment now, it's probably a better number than it was, certainly a better number than it was in November or December. There's still some real issues for people. This is not just a numbers matter. This has to do with will they recognize you when you walk into your doctor's office and say you've got a problem. They'll recognize you, but they might not recognize your form of payment. One of the things that some right-wingers say, I would never say this, they say, oh, well, gee, the rate of the increase in January came off of December. Well, yeah, that's not too hard to figure out. After all, December was the first actual month, and December, the other point is that people have a tendency to respond to deadlines. And so one of the deadlines in this law that people imagined in their mind was, I got to enroll in December. I got to get there before January 1st. Of course, the administration didn't exactly adhere to that. They kept changing the deadlines as you went along. Why, for example, did they pick December 15th? What was magic about the 2 weeks to January 1st? The answer has to be that nobody really knew how long it was going to take to submit your request and then actually get all the paperwork done. But 2 weeks seemed like a publicly acceptable number. It's interesting, the CBO projection also assumes that there will be no slowdown from, I guess it's CBO's original projection that was the basis of all this. So there'll be no slowdown in enrollment, in spite of the fact that I think times have changed. So I have to wonder about that. Okay, so then the next one. Doesn't it work? Oh, that's great. Okay. Well, I'll mime the other slides. They're graphical, so it's a lot harder. Oh, here we go. Okay. So the question is, for the people who've enrolled, are these, if you're running an insurance company, who do you want? You want somebody who pays their premiums on time and never goes to the doctor. That is the ideal client. And of course, that's not going to happen, and it especially isn't going to happen in the ACA. The website problems served as a sieve, tended to sieve out those people. If you really don't think you need insurance, then why would you go to too much trouble to get it? Why would you spend much time trying to figure it out when it's too hard to find out about it? That is the story of October, November, December. And to some extent for some people in January as well. And eventually that'll improve. But the reality is that healthy people didn't struggle too hard. People who knew they needed coverage obviously did. Older, why? Well, they got a better deal. The premium range, old to young, in most states ran anywhere from 5 to 1 to 8 to 1, meaning older people tended to pay more. Makes sense. They tend to use more health care. The law says, the federal law says, it can't be any more than 3 to 1. Well, that's a great political statement, but it doesn't necessarily comport with the actual distribution of spending by age group. And what it does say is that if you're going to give the people at the older age a break, which is what this does, then you're going to break, to a certain extent, the people at the younger age. They're going to pay more to subsidize the people at the old end. It's kind of remarkable to me that politicians would actually say we have to get those old people in to pay for this. Gee, my kids, whenever I bring up the fact that I would like them to pay for something, they're not that eager to hear me tell that. If I pick it out of their pockets, I can get away with it. The 20% who may or may not have paid the first month's premium, we don't really know what's going on there. That's a New York Times story, I guess. What we don't know is, did they purposely not pay the bill, or did they not get the bill in the first place? These computer problems at the back end continue. And then the big issue here for insurers, which I'll hit upon a little later possibly, is that a lot of people are not going to pay 12 months. And how were the premiums set? The premiums were set basically assuming that everything was going to go pretty well, and that most of the enrollment was going to occur effective January 1st, meaning 12 months of premium. So that's not exactly what insurers had in mind. Okay, golly, hard to keep up with what I don't have. So how many are newly insured? Murray has a copy. He'll pass it around to you later. And we'll all, yeah, exactly. How many people were newly insured? This is another big question. The numbers that the administration puts out, we don't really know who those people are. But the fact is that the CBO number, the secretary's number, and certainly the insurance industry's numbers, whatever they had in mind, they weren't thinking about recycling people who were already in the system. They were thinking about new business. That's the whole point, new business. And so it really does matter. We do know that roughly 5 million individual insurance policies were canceled. Now, it's the policies that are canceled, not the people. What's sad about that is that the people who bought individual insurance were the people who, first of all, they were not subsidized. Second of all, they didn't need to be convinced to buy insurance. In other words, they were doing the right things. That's what everybody says you're supposed to do. Do it for yourself. Don't do it just because somebody pays you to do it. Well, they did. They were canceled because, according to the White House, their policies were not good enough. Now, the fact is that when you get a cancellation, I can't say it's true 100% of the time, but I would find it hard to believe that any insurer who has had somebody who's been paying monthly premiums would say, we're canceling you, we're not going to offer you any more. Now, there may be some issues. They know something about your recent health expenditures. There are state laws related to whether you can really segment your market that way. But most people undoubtedly got offers. So again, we don't really know who rolled into January with or without insurance from this canceled group. But what we do know is that it is a market with 15 million people in it, or were in it this past year. And the other 10 million are going to go because their coverage isn't good enough. Now, thank you. It's a good thing we lost a few slides. Let's see. Now, what about this business about from McKinsey? 11% were previously uninsured. This is based on a survey of about 1,000 people or something like that. Surveys are a wonderful thing. I believe John Gable's survey is a lot more than I believe a survey of 1,000 people picked up, not necessarily at random, probably telephone calls, who probably don't even know what the question, did you have insurance last year, exactly means, because it's not an easy question to answer. But even if it were, say, a third, well, that would still knock the enrollment numbers down by 1 million so far. So I think there's a real question about what's going on there. Let's see. Okay, so cancellations were no surprise. They are built into the system. This was not an accident. It was on purpose. And the reason is that the people who designed this law knew that you had to stabilize this new market that didn't previously exist. And so how better to do it than to get people who are already willing to buy shifted in there. These were people, the people who were canceled, the people who the insurance industry knows something about. So the grandfathering rules were very, very strict, as many of you know. Essentially, if there was any significant change in the policy, it couldn't be grandfathered, even minor changes in co-payments, deductibles, that sort of thing. So that was on purpose. That was not an accident. By the way, there's a typo there. There's a word lower somewhere. Actually, there are a couple of words missing there, but don't read that too closely and you'll be just fine. Let's see now. Okay, now, how do we know that technicians in the government knew? Well, they put it out in regulations in 2010. And they knew this about the individual market, and they knew this about the employer market. So in fact, cancellations are not over. I think a good question is how many people will be canceled by the election? They will be canceled by the election because, of course, most people have to select another plan sometime in the late fall, and you have to get the cancellation notice first before you find this out. And the cancellations are going to be also heavily concentrated among, or potentially heavily concentrated among small employers as well. Okay, let's see. I have a feeling I was supposed to say something more about that, but okay. What about Medicaid? Another kind of a sad story. So HHS says that there were 6, they haven't been talking about Medicaid that much. I think it's harder to know about who's really enrolled, but it's a much dicier issue. So in December, a spokesman said 6.3 million people had signed up by, at one time, I knew the date, but sometime through December, I guess, in Medicaid. Avalier, which is a consulting firm in Washington, said, well, there's a lot of churn in the Medicaid program, and there are always a lot of renewals. So they just did a back-of-the-envelope rule of thumb sort of thing, and they think that the number of newly enrolled Medicaid people might range for this period through December, which is early now, might range from about 1.1 to, 1.8 million people. Again, the question is how many net new people are covered. In Medicaid, it is actually a commercial issue, because who runs Medicaid programs? Well, it turns out that insurance companies tend to be contracted by state Medicaid programs. Okay, here's a funny one. Oh, no, I missed that one. So our mandates mandatory. Okay, I can tell you that one. So it was a picture of Charlton Heston holding the 10 Commandments. And the caption was, the ACA has more than 10. Okay, so anyway, look, it's economist humor. You got to give me a break. Okay, so our mandates mandatory. You didn't stand, Murray. I'm not going to recognize that. Well, only if it's convenient. So the employer mandate, of course, was delayed. What's the whole idea behind the penalty here? I think it's a pretty stiff penalty for the firms that are most likely to need the encouragement. It's not the really gigantic firms. It is the kind of the mid-range firms, and I'm not sure what mid-range exactly means, but they're not really big companies. And so, for a 50-worker firm, this is the lowest number of employees for whom this penalty could apply. They could potentially face a $40,000 a year fine for not offering acceptable coverage to their employees. Again, it's sort of a complicated thing, but it was meant to get their attention, and in fact, it was meant to get the attention of precisely the firms that have now been exempted another year. The 50 to 99 range of employees, they've been given another year to think about it. Above that range, 100 employees or more, they have to provide acceptable coverage according to the ACA, but only for 70% of their employees. That is kind of a puzzling thing, and that has something to do with trying to make a simple statement, a complicated world fold into a simple statement, a simple regulatory statement. It's actually not regulatory because, of course, no regulation was pushed through the process. So there's no comment on this. But the fact is that there are firms that have part-time workers, they have seasonal workers, they have all sorts of strange employment relationships, and it's really hard to get all this right. And so I don't blame the people who drafted the law for not even knowing all of these things. But I do think that there was enough time, it's been quite a few years, for somebody, maybe the Labor Department, to actually think about, well, gee, how do firms actually work when it comes to employees? So this was another thing that wasn't really figured out. Okay, now let's see. Individual mandate. Okay, so the individual mandate weekend. Now, what's interesting about this is that this is purely a reaction to the cancellations. The penalty, again, was the penalty ever really meant to put the fear of God into anybody, or was it that you needed to say that you must do this? And I think it's the latter. It's really a very small penalty. I think the purpose of the individual mandate was to put in front of everybody's mind that you should buy insurance. And I think that mission was largely accomplished. But the penalty, very weak ways of enforcing it. The IRS isn't allowed to use its usual gentle techniques. I hope none of you are familiar with them. And the penalty itself is really, really very small, way below what most people who might be penalized could expect to pay for insurance. The cancellations drove this blatantly political reaction. And in fact, we all remember, late October, the president said, well, those cancellations are those bad apple insurers. And then later on, he said, oh, well, he didn't mention bad apple, but those insurers, yeah, if you want to keep those plans, you can. Completely, downplaying the fact that there's a regulatory process in every state. So the state insurance commissioner has to say that's okay. And the insurers have to say they're willing to do it. And the customers that were already told, get out of my house, you have to somehow market back to them. It's a very messy thing and largely a false promise because, in fact, the people who were canceled were most likely to have wanted to buy insurance on their own anyway. Why can't, if this is such a good idea, why can't we give everybody the same choices? I think that's a simple question. The uninsured, who by and large are lower income people, poorer jobs, less well off, they don't get those kinds of options. They have to go in for these more expensive policies. Yes, there's a subsidy. It doesn't necessarily take care of all of the cost.
Into penalty time.
Thank you. Always the question, when do I sign up? That was very confusing. I just want to make a comment about moving the open enrollment period. It was going to start on October 15th this year, and now it's going to start on November 15th. The claim that this will give insurers, this is a quote, give insurers more time to evaluate the market. 1 more month? I don't think so. They need cost experience. And if CBO is right, if the administration is right, there are going to be a lot of people, basically, as many people who signed up so far will be signing up, apparently, last week in March. So actually, the insurers will have zero cost experience with those people, and even worse, zero premium experience. Well, okay, it's fine. I'm sure there's a reason for doing it that isn't just political. Now we have to protect insurers against risk. Insurers, really, they don't know how to handle risk. Have you noticed that? So there are a whole bunch of schemes here. I don't have time to explain any of them. Happy to talk to anybody about it, but the reinsurance one I just want to mention, all insurance plans, including the ones that are self-insured, the ones that most of you have to pay the tax in order to come up with the $20 billion subsidy for the exchange plans. So just keep that in mind. Okay, now, is this going to be a bailout? In particular, the risk corridors. They're not budget neutral. Theoretically, there could be money put into the insurance exchanges, into the insurers who are in the exchanges, rather than being taken out. The fact is that you need something like this because of the huge amount of uncertainty associated with a completely unprecedented set of policies, things that we have never seen before, some things that we have seen before that haven't worked, witness New York and New Jersey, health insurance regulation. As I mentioned earlier, the bids assumed an orderly implementation that didn't happen. And then also, let's not forget that the regulators had big political motivations to hold down the bids. I'm happy to send you to the Maryland site so that you can see what the insurance commissioner said about what their great accomplishment to basically say, we don't, even though we don't have any better information than you do, we don't believe your premiums are good, and we're going to reduce them in many cases by 50%. CBO says that the federal government will gain from risk corridors. There will be, $8 billion net revenue from this? And we could get into whether I believe that or not. I'd be happy to have a little seminar on that separately. But if it's true, then what's the big deal about repealing them? Why are the Democrats so upset about what I think is blatantly political Republican ploy that won't go anywhere. But what's the big deal? If this is really true, I mean, CBO, they believe CBO sometimes, not all the time. So anyway, they want to believe that. But on the other hand, well, gee, we do need the risk corridors. Okay, time. Well, I'm going to go through a couple more slides. Okay. Oh, I didn't show you that one? Okay, that was my picture. Okay. Okay, the leisure life. The fact is, the point I want to make is, anybody who's ever taken Economics 101 knows this to be a fact. When you have means-tested or income-related subsidies, you create, in essence, tax cliffs. And people have incentives to pull back on their work hours if they're kind of close to the edge. Certainly in the case of somebody who, if they made another $1,000, if they could make another $1,000, they'd go from Medicaid status to non-Medicaid status. Even with the big subsidies, that means a big increase in their costs. And if they can only increase their incomes by $1,000, they're likely to say, gee, that's not such a great idea. The idea that a whole bunch of people are going to go out and start companies, that's a upper middle class idea. We should be concerned about the people who this was supposedly aimed at, which is low income people. But nobody ought to be surprised at CBO's, the general nature CBO's finding, leaving aside whatever numbers you want to believe. So, this is nothing to cheer about. As a commentator, a liberal commentator in the New York Times said, and this is a quote, we are basically recovering from the recession by reducing the share of Americans who participate in the labor force. Hurrah. That's what that picture shows. Okay, so just look at the picture, study it carefully, and we'll move on. I put a lot of effort in these graphics, so I want you to see them. Okay, so I'm going to do a few outlook things. Outlook for the budget. Okay, well, I'm my usual upbeat self. Republicans obviously lack leverage. That fundamentally won't change after the election, no matter what happens. The president is still the president. I think the Democrats are not interested, or they don't want to go out too far ahead of anybody. So at least for this year, given that it's an election year, nobody really wants to make any sudden moves. I think the budget deal and a bunch of other things that have kind of rolled off rather quietly in the last month tell you that that's true. That also implies to me that the doc fix probably isn't going to happen. Yeah, there's a lot of enthusiasm. No, it's not on sale. No, hospitals don't want to pay for doctors. So better luck next year. Outlook for ACA and health spending, unsteady as she goes. And I'm going to use the word cost shifting, and for those of you who are economists, you can berate me later. But cost shifting, actually the great thing about the ACA is it actually made cost shifting come true. Cost shifting, economists always say that cost shifting can't occur because if you don't want to buy something, you won't pay the extra price. But if you want to believe the strength of the various mandates, you have to pay the extra price because you have to buy the stuff. So anyway, but cost shifting is already being felt. The small group market, those small firms that didn't re-up and get another year of the plan they had last year, their rates have gone up. It's being reported, beginning to be reported now. And the reason is that they are essentially in the same risk pool as the not so great risks that have signed up for the exchange plans or the ones who might be coming down the road in the next couple of months. There are different pools, all right, but it's the same company. And so in the end, the company is going to level things out in a way that means that if you didn't re-up your plan and get another year's reprieve, you've got higher premiums this year. Check with your local retailer. Well, let's see. Do I have anything more to say about this? I think a big question for the fall and for the new offerings, will we see fewer offerings? I think we'll see fewer offerings than we did this year. Higher premiums and higher cost sharing and tighter networks. The big wild card here is politics and regulation. Politics will unnamed sources who are quoted in the Washington Post lean on insurers. Will the state versions of those lean on insurers? I think that's highly likely. So maybe those things might not happen as much as they could. I don't think that the insurers are really counting on the various risk adjustment mechanisms to really bail them out because they know that the law can change. But maybe not this year. It's hard to say. And there's a network adequacy issue that comes out. I had a great slide, which I can actually tell you about. It was my real. These are. Let's see. No, I don't have it. Okay, so I was really looking to the future, and one of them was I had a picture of a hockey player, and my prediction is that the U.S. Olympic hockey team will win the gold medal. My next prediction was it was a picture of Chris Christie, and my prediction was that Chris Christie is going to drop out of the Republican presidential race, but good news. He's going to run for mayor of Fort Lee, promising no more traffic from New York. Thanks a lot.